face again, it will become wider. So you need the upward vector to lift it up. And this is the main anchoring ligament of the fixed point that we can use. It is the superficial fascia zygomatic ligament, palliative cutaneous ligament, and latissimus auricular ligament. These are very important, and you have to locate before you start the trace lifting. And for the lower face, I prefer in subcutaneous layer, not a deep layer. So now we have the three parts. The upper face, I prefer to use the deep plane. For the mid face, I use the superficial plane. And also for the lower face, I use the superficial plane subcutaneous. So now first, I identify the platysma auricular ligament. Normally it approximates 1 centimeter behind the mandibular angle. And the hanging point is at the jaw. And sometimes if you have the submandibular, you can use the submandibular for the hanging point. Then I draw a line from the line to the ear to identify the point that I would like to hang for the second point. The entry point it would be at the zygomatic arm above the trachea. This one is a line from lateral canthus that I would not cross because this lady she is young, so I no need to make her face become flat. Now you can see the line of the trace that I plan to do. And for the upper vector, I go from the hairline in the temporal area downward to the line that across from ala to the to the earlobe. For at this point, sometimes we may need just only 1 or 2 entry point. In this lady, she is not that much setting, so I just use only 1 point. Okay, this is the technique. You see, this is the I mark the platysma, the platysma auricular ligament. At this point, it's a little bit sticky. When you pass through, sometimes it's difficult. You make sure that you are in the subcutaneous layer, and you inserting the second thread into the same plane, and make sure that it's not hooked with the dermis, because if it's hooked with the dermis, your skin will be uneven. And this one I use the eye thread is the L-type cannula that is really easy to get or pass through in the subcutaneous layer. And the thread is a 5 thread. That's for the upper. I have to pass through the zygomatic arc, and I have to make sure that I am crossed over the zygomatic arc by pinching the skin at the zygomatic arc. And at this point, you have to aware of the frontal bars, temporal bars of the facial nerve, because it will pass at the mid zygomatic arc. If you go too deep on the bone or on the arc, you may injury to the facial nerve. So now you can track the skin by tracking the thread. Normally it takes about 10 minutes to do per side, but this one is a double skin. will see the result left and right. On the left side of the face, I haven't do anything yet. You will see that the face is get smaller and get in the good shape. So this is the simple technique and very effective. Thank you for your attention.
Okay. So thank you very much for the nice presentations. So let's move to the next speakers. The next speaker is Dr. Thanisat Vibukulase. So Dr. Thanisat completes the medical school at Thammasat University, and he proceeds his diploma of American anti-aging medicine, and he is also the KOL of the EdTech Pharma and KOL of Ultra-V, and currently he is the director of รักคุณคลินิกใช่ไหมคะรักคุณคลินิกค่ะ Please welcome Dr. Thanisat.
Good evening everyone สวัสดีครับทุกท่านขออ่านโพยนะครับ เพราะว่าเพิ่งทราบว่าต้องพูดภาษาอังกฤษเมื่อ2-3 วันนี้ครับ แต่ว่าก็เดี๋ยวจะพยายามเต็มที่เนาะ Today my topic is trade in solid and soluble form. I think everyone know well there are many factors affecting trade lifting. Example, material, technique, and patient. Patient who have more extreme sagging and excess skin is poor candidate as we know. So, if we have a good material, good technique, and we have a good patient candidate, we should have a good outcome and decrease complication. There are many combination treatment that we use together with trade lift. Example, we inject toxin on proximal muscle, we put some monotrate into the skin for stimulating new collagen because we need a better result. Today, I will share one of combination technique is an undercore and under-V trade. Undercore is a PDO powder. It's very small particle size around 30 to 70 micrometer. It's a uniform round shape. PDO powder is a collagen stimulator and biodegradable material around 6 to 12 months and less than side effect. Undercore get KFDA in 2019 as a dermal filler for nasolabial injection. Research for 48 weeks in 72 patients. After inject PDO powder into the skin, it will stimulate new collagen for 12 weeks or 3 months, same as the other collagen stimulator. This study to show PDO powder can stimulate new collagen, improve skin roughness, and is better biodegradable material when compared with the other polymer. This PDO powder study in mouse and human. They find that after inject PDO 3 times in 1 year, it improved skin dermosity 34%, improved skin wrinkle 13%, and improved skin radiance 9%. There are 2 million particles in 1 bottle of undercore, and the surface area of all particles around 15,700 square millimeter. If compare the surface area with monotrate 29G 50 millimeter long, there are around 1,427 pieces of monotrate. In practice, it's impossible to put 1,000 monotrate into the skin, but we can do it by undercore. Before use, I mix undercore 4 cc with a saline water 4 cc and check it around 10 minutes. After that, I add 1 cc of lidocaine and check it again around 5 minutes. So mixing time is 15 minutes. Anthracoal can inject almost every area on the face because it's very same material. Recommended in 1 year, less side effect of inflammation, nodule, or granuloma. Okay, this video to show the technique of inject Anthracoal. Before treatment, you should do nerve block for pain reduction. I recommend you 21 to 23 G of cannula. The plane of injection is subdermal plane or superficial subcutaneous fat layer. You should slowly lidocaine injection technique and always be well pointing down. Okay. This picture, you will see dose and direction of Anthracoal injection. For lifting technique, should slowly continuously lidocaine injection. Dose around 0.1 to 0.2 cc per ride. Don't use bullet technique. After treatment for 1 month, you will see the improvement of skin quality and lifting effect, improved skin wrinkle, skin radiance. For this case, I inject only 2 bottles of Anthracoal. I didn't do thread together. This case, I inject 2 bottles for 1 section of Anthracoal. We can see lifting effect and improve of skin quality. Improve of skin quality is the highlight of Anthracoal. For young case, you can see the result of lifting effect and skin quality also. Look at her under eye. There are clearly better results. For combination treatment, I usually use morning PDO or morning COP 19G, and I prefer W type of cannula. Anti morning COP is very strong tensile strength and it has special lower part of for better lifting effect. You will see the special lower part of anti-wing thread is highlighted. For lower face lifting, I use 5 to 6 plates to correct sagging cheek, thread4, and malleus line. I usually inject tumescent to create the white paint before insert all thread. It's very easy to do. For this case, I use combination technique also. Firstly, I insert all thread and then adjust the tension of all thread. You should adjust the tension of all thread before inject Anthracoal powder, Anthracoal PDO powder. After adjust the tension, I inject Anthracoal subdermal plane. So I can simulate 2 layers of collagen. So I call this technique collagen. You will see immediately effect after injection. It's not more swelling than thread lift alone. It doesn't make that the downtime longer than just thread lifting. This case, after 1 month combination treatment, you will see good result of thread lifting and improve of skin quality. So, combination of Anthracoal solid thread and Anthracoal PDO powder for better result of thread lift. More last longer effect, improve skin quality, improve dermal density, decrease skin wrinkle, and increase skin radiance. Thank you.
Thank you all the speakers for this very informative presentation of today. And now I'm the representative of the audience to give some speakers some questions. So the first question will be for be appropriate management if we somehow accidentally pass the thread to a vascular structure during the procedure?
The question is, if we insert the thread and it passes through the blood vessels, in case the blood vessel is small, then we just, of course, place it maybe 2 to 5 minutes. But in case that you pass through the bigger blood vessels, the thread, when you move the face, so it will tear the blood vessel all the time. So the best way for me is remove it. So you have to pull it up for me strongly until all the thread come out, and then press it for another 5 to 10 minutes. We have the face collar that can continuously press the wound. And also if there is a huge already hematoma, so that is much more difficult. We have to add the antibiotics, stronger one, because the blood can be a good medium for the bacteria as well. So in that case, I would like to say that if it's still tearing into the blood vessel, the big one, or even the muscle, you have to remove it and then compress it and treat accordingly.
Thank you. We just had another question just now. May I ask another question, Dr. Pesan? What would it be in management for an infection from the thread?
Actually, there's one interesting case from the Thai Dermatological Society about 5-6 years ago, that there is one patient coming in to the Churangkorn, and there's a dripping of the pus from the one point, and the patient has a history of the thread inserted 6 months ago, and she was treated with all kinds of antibiotics, Campos, Croxacillin, Augmentin, until Coram, Phenicol, and still the dripping, the pus on the site of the thread inserted. So they came to the hospital, and the doctor did the culture, the pus culture is come out negative. So they did the biopsy, very deep one, deep down to the fat. And the histology show there's a mycobacterium infection. So in that case, lastly, she was prescribed with the INH, rifampicin, for another 6 months, and then the infection dry off. So in that case, even though the thread as a foreign material, you have to treat rigorously, Gamnet, Campos. You can use even Cetazole, the third generation cephalosporin, for 1 or 2 weeks in case of the severe or deep infection. But in that extraordinary case, it's coming from the mycobacterium, so it's more complicated. But at last, it was treated with the proper antibiotics, then it will be healed.
Thank you so much, next, the audience would like to ask Dr. Thanya about the multi-directional cork thread. The first question is, what is the estimate cost roughly for the whole face treatment, and do you find it quite cost effective in comparison with traditional filler augmentation?
How can I be more precise on the cost?
Yeah, definitely different brand come with different costs. So I think the question would be the cost effectiveness in comparison with the filler augmentation in general.
I think because that I mentioned that this is like a concept of the design.
size, so I did it like maximize, like this is the maximum design, and then you can customize it according to the individual patients. However, I did 10 threads per size, so it's around, like whole face is around, cost around 3 cc of the fillers, in average. 3 cc of the fillers, and another question is like cost effective, right?
Yeah, I mean, if you have to choose between 3 cc of filler and around like roughly like 8 to 10 thread.
As I told you that the successful of the thread lifting is to assess the patient. It's not just only design, so you need to assess the patient. So I think if you assess the patient and the patient has like sagging of the fat compartment, that you can repositioning, something like that. You can go out with thread. But if the patient has more volume loss, you need volumizations, like aggressive volumization, like subsarcoma or like hollow cheeks, severe loss, something like that. You may need to use the fillers. Or if the patient want to have like more projection, like chin protrusion, something like that, you cannot use thread because you need something more precise. Or you can like combine, like assess the patient.
Yeah, I think that's absolutely true. And the next question is, what is the least amount of the multidirectional hop thread that you think is effective enough to cause significant lifting? I mean, can it be less than 10 or it has to be?
Yes, it can be less than 10 because that is like a maximum design, as I told you, so you can improvise. But however, because for the end finders, one pack has 6 threads. So the minimum should be 6, because you need to open it anyway.
Next, I would like to ask Dr. Owen นะคะอาจารย์โอวินอยู่ไหมคะอ๋อค่ะ the audience asked that would it be any negative impact for a previously thread patient if they would like to do a nose augmentation, surgical nose augmentation in the future? If the patient had the thread nose augmentation and then subsequently they would like to have a silicone augmentation later, would it be negative effect, for example, fibrosis or something like that?
Yeah, for sure you're going to have the fibrosis, of course, because you have the trauma in there, but it's not a problem because you know that the nose augmentation, sometimes patients that do the surgery with the silicone, sometimes they have like 5 or 6 times already. So it doesn't matter. This is like less trauma than surgical, right? Less trauma than surgery, so it's no problem for the surgeon. If someone do the rhinoplasty, they know that. Maybe to me, I do the rhinoplasty with silicone also. Sometimes the second rhinoplasty is a little bit better because it's less bleeding, less swelling. If you do the virgin case, it's going to be more swelling. So the case that have a little bit fibrosis is going to be a little bit less swelling. So to me, it's not a negative. Maybe it's a positive.
And on the other way around, if the patient has previously nose augmentation, silicone augmentation, would it be still the good candidate for the thread?
Yeah, that's going to be a problem because when you do the surgery, it's going to be more fibrosis, right? Because the wound is bigger, so it's going to be a little bit stiff. So it's dependent how you can lift. You have to adjust, but still you can do something, right? But maybe not like the best result. No, เขาหมายถึงว่า you mean remove silicone, right?
No.
There's silicone in there.
Silicone is still
Oh
there.
no. So normally, if you have a silicone, as I told you, the skin is very thin. You cannot put under the silicone. It's very difficult, right? But if you can try, but you cannot lift silicone with the thread, of course. So it doesn't work. You're not going to use the thread.
So it's been that after rhinoplasty, we should not use the thread.
Yeah, because I think it doesn't work because you put the silicone in your nose, your skin upper or the structure over the silicone is going to be really thin and fibrosis. If you put the thread in there, first it's very difficult to put in there. Second, you're going to see the thread, right? So I don't think it's going to be good.
And thirdly, I would say that you might introduce the infection into that silicone block so that is more.
Put it on after the day. Yeah, I don't think it works.
Very nice. Okay, I have two last questions for Dr. Danai. Dr. Danai, could you please share us your daily healthcare routine to be this handsome at this age? I would not to say, I said myself, Dr. Paisan something, but he said Dr. Danai. At this age, humankind, we need to know this. So she put a big mark. And also on time, one more from our participants อาจารย์ครับอาจารย์ดนัยจบอโถ1955หนูเพิ่งเกิดค่ะอาจารย์ทำยังไงให้ดูเด็กได้ขนาดนี้ช่วยแชร์เคล็ดลับในแวมไพร์เป็นวิทยาทานหน่อยนะคะก็จะมีฟังอยู่เชิญนะอาจารย์ดนัย please
I think all those questions is beyond the new frontier of the thread our topic. But actually for me, I think right now I still going on my disciplines. Yeah, I do everything in balance. I work and also I rest and also exercise and the thing you eat is very crucial for how you keep your routine like this. Yeah.
So work-life balance and exercise. I saw Dr. Danai Facebook quite often. After very hard work, very tight schedule, he's still going on the exercise. And also wine, right?
Yeah. Okay. Some antioxidant is also help for emotional factors. Yeah, but I think I already present something that maybe you can adopt to your practice, especially for the thread. But I hope that I favor to have some question more about how we can do test safely. But anyway, anyhow, if you have any question, you can contact me directly. Okay, thank you.
Thank you. Are there any questions from the floor or something you want to share with us with your own thread experience?
Some about the technique. Some question from the floor about the anesthesia. What is the best anesthetic option in comparison between nerve block and local infiltration, or should we do both? What is your technique? Please share.
Normally, I prefer to use the local anesthesia. I didn't use the block because I would like to see the dynamics or sometimes any complication if we insert the thread into the muscle.
Do you do like a sharp needle injection or use the hole and a cannula local
I use
injection?
a sharp needle and I use this very little amount. Normally per side of the face I usually 1 cc of lidocaine with adenine.
I think Dr. Paisan already answered a bit about this question, but maybe I can ask Pitong again. What is the post-op management to you? Do you use any like thread or bandage to fix the face?
Normally no. And I just recommend my patient that no massage around a week. But you can touch your face gently and try to do not sleep on the side. That's it. That's what I do.
Do you give the antibiotics routinely for?
I never give any antibiotic because before I clean many times on the face with the antiseptic, and you will see that I use the green or the blue cover to protect the field. The antiseptic is really important than the antibiotic. Have to remember.
For the aseptic technique.
Yes, sorry.
One last question, sorry.
Yes.
About the removal of the thread, is it something you commonly do when you think there is an infection or sign of infection or some unwanted?
If I see the extrude thread, I remove. And if I do not see the extrude and it's just only inflammation or it's like a nodule, I just the oral antibiotic.
Thank you so much.
Thank you.
That's all from the question that I got in my hand. Anything else from the audience right now?
crisscross. We have seen อาจารย์ธัญญาor อาจารย์พัชยาพร putting this way and also cross the thread like this จะไปกัดกันไหมครับ
กัดได้
effect on both thread are there.
Yes, from my experience, I think the most important thing is depend on the size of the thread. The size of the thread. Yes. So the end finders, the thread that I use is 21 gauge needle. So the size is quite small. So that why it can crisscross. But in another thread that like the size too bigger, it's very difficult to bend down. Like the needle, and it may interfere with the thread that you have already inserted.
So we have to, at least if we go one of this direction, another one we have to know that these levels we have to put shallow a bit up to cross on the same plane.
Yeah. So that is like just only concept of the design, but you need to respect the design in each brand also. It's different, so customized.
I think we have learned a lot since the morning, and it's already about 5 p.m. So I wish you have a nice evening, and we will meet together again for tomorrow. So I'm not here, at Chulalongkorn Hospital. And once again, our president wants to emphasize that for the thread, the basic concept is you putting the thread for the beginner on the superficial plane, and for the advanced tomorrow that Dr. Chan gonna show us, and also on the anatomy